Cardiovascular or blood vascular system is formed of a muscular pump, which is the heart, and a closed system of branching tubes, which are the blood vessels. Blood vessels differ in size and serve to deliver blood from the heart to the different tissues and organs of the body. Then return the blood back to the heart from the body, thus distributing oxygen from the lung, nutrients from the gastrointestinal tract, and regulatory substances as hormones from endocrine glands to all organs of the body. Blood vessels also carry waste products to organs as the lung and the kidney for elimination. Heart is formed of two halves. Each consists of two chambers, an atrium which collects blood and a ventricle which pumps the blood. The right atrium collects unoxygenated blood from the body and propels it to the right ventricle, which in turn pumps the blood to the lung for exchange of gases. On the other hand, the left atrium receives the oxygenated blood from the lung and propels it to the left ventricle, which in turn pumps the blood to the body. Valves are important to allow the blood to flow in one direction and prevent regurgitation. Structure of the wall of the heart. The wall of the heart consists of an inner lining layer, endocardium, middle muscular layer, myocardium, and outer fibrous layer, epicardium. Endocardium lines the chambers and valves of the heart. It consists of endothelium, which is simple squamous epithelium and basal lamina, and subendothelial connective tissue. The subendocardium is made of loose connective tissue with elastic fibers, vessels, nerves, fat cells. In the ventricles, however, it contains also specialized cardiac muscle fibers. Subendothelial connective tissue binds the endocardium to the heart muscle. Myocardium is formed mainly of cardiac muscle fibers arranged in different directions. Between them are interlacing network of elastic fibers. Impulses for cardiac muscle contraction occur rhythmic from one cardiac muscle to another in the absence of external stimuli. Pericardium is the sac-like structure enclosing the heart, formed of two layers containing fluid in between, which allows the layers to slide during contraction and relaxation of the heart. The parietal pericardium is the outer layer, composed of fibrous connective tissue lined by mesothelium, which is simple squamous epithelium. The visceral pericardium is called epicardium, is the inner layer which is reflected on the wall of the heart. It is also composed of mesothelium overlying a layer of fibroelastic connective tissue. Deep to it is an adipose connective tissue containing coronary vessels and nerves. Cardiac skeleton is formed of dense irregular connective tissue to which is attached the cardiac muscle. It includes annually fibrosy connective tissue around the openings of the aorta and pulmonary arteries. trigona fibrosi, connective tissue between atrioventricular and atrial openings. Septum membrana in the upper part of the interventricular septum. Valves are composed of dense collagenous connective tissue and have an endocardial covering. They are tricuspid valve between right atrium and right ventricle, pulmonary between right ventricle and pulmonary artery, mitral between left atrium and left ventricle, aortic between left ventricle and aorta. Function of cardiac skeleton. Cardiac skeleton is an attached lines for roots of the heart, valves, and cardiac muscle. Also, it prevents outlets of the heart, like aortic or pulmonary opening, from dilatation when blood is forced through. Conducting system of the heart. It is a specialized type of cardiac muscle fibers responsible for initiating and maintaining the cardiac rhythm. It makes the atria and ventricles beat in succession, allowing the heart to function as efficient pump. Composition. Sinoatrial node, SA node, is the pacemaker of the heart, located in the right atrium close to the entrance of the superior vena cava. Atrioventricular node, AV node, located close to the septal wall of the right atrium. Atrioventricular bundle of Hess, AV bundle, formed of specialized muscle fibers, Purkinje muscle fibers or cells. The bundle divides into right and left bundle branches. Each one goes to a ventricle where it divides into several side branches, making contact with ordinary cardiac muscle fibers, thus conducting impulses to all parts of the ventricular myocardium. Impulses started at the SA node, then goes to the atrial cardiac muscle, then AV node, atrioventricular bundle of Hess, then to the ventricular myocardium. Purkinje fibers or cells. They are modified cardiac muscle fibers found in the AV bundle and its branches. Purkinje fibers are best seen in sections of moderator band. Structure. The moderator band is formed of bundles of cardiac muscle fibers covered by endocardium and traversing the cavity of the right ventricle, carrying right branches of the AV bundle to the lateral wall. They run parallel with little connective tissue in between, very rich in blood capillaries, nerves, and some fat cells. Histological characteristics. They are larger and paler than cardiac muscle fibers and grouped in bundles from 2 to 5 fibers. Sarcoplasm is rich in glycogen, so it appears vacuolated, as glycogen dissolves during preparation. Purkinje fibers contain few peripheral myofibrils. Their nuclei are numerous and eccentric in position. They have no intercalated discs or striations. They make contact with cardiac muscle cells through junctional complexes and not through typical intercalated discs. Function. Purkinje fibers have a faster rate of conduction than ordinary cardiac muscle fibers. Blood and lymphatic vessels have a common basic structure formed of three coats or tunics, which differ in composition from one vessel to another. These tunics from inside outwards are tunica intima, tunica media, and tunica adventitia. Tunica intima or interna is formed of endothelium, which is simple squamous epithelium, subendothelium or subendothelial layer, which is formed of loose connective tissue, internal elastic lamina, formed of elastic fibers located between tunica intima and tunica media. Then tunica media, which is the middle vascular coat of the blood vessels. It consists of circular smooth muscle fibers and elastic and collagen fibers in between. External elastic lamina may be present between the tunica media and tunica adventitia. Tunica adventitia or externa, which is the outermost coat of the blood vessel, it consists of loose connective tissue with few elastic and collagen fibers together with tiny blood vessels, vasa vasorum. Adaptation of structure to function of blood vessels. Endothelium provides a smooth surface for blood flow. Smooth muscle fibers regulate the blood flow by contraction and relaxation. The tone of smooth muscle is regulated by factors secreted by endothelium and by its innervation by autonomic nervous system. Elastic fibers allow expansion during systole. Their recoil helps the blood flow during diastole. Elastic laminae, internal elastic lamina, and external elastic lamina prevent complete occlusion of the vessels during contraction, as in coronary vessels. Tunica adventitia prevents overexpansion and rupture of the blood vessel. It connects the vessel to the surroundings. It prevents shortening of the vessel if it is cut. Tunica adventitia contains small blood vessels, vasa vasorum, for nourishment of the vessel wall in large vessels.